What's up, guys? This is Jay from COI, and today I had a interesting debate slash conversation with, I would say, a political opponent, if you will. Honestly, just kind of somebody I know in podcast universe, and we were talking about Medicare for all, and he said, "Yeah, but do you understand that our current health insurance system employs a lot of people, like 2 million jobs? What happens to those people?" And I thought that was really interesting. Now, this guy, he has 3 kids. Um, his parents are still alive. He's rather young, not exactly what I would call wealthy. And I thought, why do you care? You're telling me that your parents and you and everyone could have health care. Why are you worried about these people? And brought it up to him. And I said, why does it bother you? And he said, well, I don't have, it's not like I'm heartless. I care about what happens to these people's jobs. But they don't give a shit about you, I told him. And I went on to explain to him that one of the biggest jobs that is in the health insurance industry is denying you health insurance. Taking it to litigation, proving that you filled something out wrong, proving that what you're claiming didn't happen or it doesn't fall under you know, their guidelines for them to cover it. 1 in 5 claims are denied on average from health insurance companies. 1 in 5. Why do you care what happens to these people? They tell you, hey, you pay into us every month. And by the way, somewhere between $400 to $800 in up every month. And then when you need us, we're going to say, no, we don't cover that. We don't worry about that. Uh, so why do you care? I really could care less what happens to these people. And look, as far as their jobs, all right, as individuals, sure, some of them are great people. Um, we're all stuck in a position sometimes working for Satan. So I get that. I don't wish any ill will on these people, but I don't think they should have these jobs. I mean, if there was a job that was to torture babies, I wouldn't be cool with them having that job. Um, yeah, but it's 4 million people. Yeah, it's all right. We don't need to torture babies. I found that argument very um I I want to say very brainwashed to be like, but what about the hive? And not thinking about yourself, not thinking of the damage that these companies do to people and to families. My father recently had a hernia surgery, and it was really bad, really, really bad. Um, it was in danger of him going septic. They had to cut him from groin to liver, basically. I mean, he looks like he got into a fight with a samurai. It's bad. Um, it was a 7, 8 hour surgery, which is I mean, even the surgeon himself said, I've never done a surgery like that as far as a hernia is concerned. Um, the recover time was even longer, and in fact, he got an infection, had to go back in. He had to stay in the hospital for 4 or 5 days after his initial release. I mean, our biggest concern was keeping my dad alive. What did the health insurance do? They denied it. My parents are dealing with them right now because Humana said they didn't approve it, even though they did. And I've talked to people in the medical world about this, and they say, "Oh yeah, Humana does that a lot." How can they exist? Why are we fine with them existing? In fact, the HR person I was talking to at the hospital, she said, "Oh yeah, there's a whole step-by-step procedure that you do." And she handed me this card. It was already all printed out of how you basically push back on Humana and get them to finally accept it. And then she was like, "Yeah, but they don't always do that, and so we end up eating the cost." And she wasn't wrong. Did you know that the cost of insurance denying claims to a hospital, to the hospitals in America, is about $262 billion every year? And they worry about Medicare for all destroying the hospitals. Well, doctors aren't going to get paid. Sounds like the insurance companies are going to destroy the hospitals. But the fact that there is a process in place to fight back on these insurance companies when they deny your claim, because it happens so regularly, is ridiculous. And we're worried about them. We give a shit. I don't. I could give a shit less of what happens to these companies. Not to mention the cost. And we've been over this millions and millions of times. The United States pays more than double of almost all first world countries, and we are covered the least. Our current healthcare system over the next 10 years would cost $49 trillion. Now that's a high mark. I've heard some as low as 36. But regardless, the high end that I've heard from places like Fox News and Drudge and all the places who are shooting down Medicare for all, over 10 years, the high end on that one I've heard is 34 trillion. 28 is the lowest I've heard, and about 32.6 is the one I hear the most. Regardless, it's cheaper than our current healthcare system. And here's the big kicker: everyone has insurance. I don't know why that idea is so disheartening to people. I'll tell you why. Because in our country, there's the haves and the have-nots. And there's so many have-nots who feel like they deserve to be have-nots. They allow companies like the Coke industry, like Walmart, to use their bodies like tools. And when they're done with you, you let them throw you away. And when you want your pension, they'll fight you. Nah, you don't deserve all of it. You only get this amount. And we'll keep you held up in legislation while you're not earning any money, and you'll settle out for a way lower figure. Do that all the time too. That's the problem. Some of us believe we're dogs. Others of us are ready for a revolution. All the way, it's got to start somewhere. And it's not the romantic taking a hill with a machine gun on it kind of revolution. It's the revolution of all of us giving a damn and actually developing some self-respect. Not for us, though. For our children. For their children. We talk about the greatest generation and how selfless they were. And they were. The things that they did marked nearly on as far as starvation for their children. And we won't even stand up and fight for health care for the greatest generation, for our children, for the people around us. We're like Pavlov dogs, and we believe we deserve it. I don't know. That's it for me, guys. Tomorrow's episode, I am going to talk about Rudy Giuliani and Trump. In interesting lights. They both did TV in the last few days, and I was actually going to do that today, but this story with my dad came up, and I really wanted to talk about that and this debate, and I really felt like it was a little bit more important because honestly, the Trump story, I just found it kind of funny. I don't like the man. I definitely think he's an awful president, but sometimes his free flow talking just cracks me up. But anyway, I'll be talking about that and Rudy Giuliani on Blaze TV. I'll have that episode up tomorrow, and I did an interview with comedian Gabriel Rutledge, and I'll have that one up as soon as I can. I unfortunately didn't get that one done right. We had some really bad technical issues, so it's just a blank screen. I don't even have any pictures of him or anything like that, but we are working on doing just a stream. I don't want to do that because I don't really care about my face being seen or people knowing who I am. It's just how I feel. Um, so I don't know how that's going to work, but I am kind of working on something like that. Because I know some people are complaining about the slideshows. Other people who are more radio podcast people, they feel like they have to watch it and they're annoyed by that. So I don't know. Anyway, guys, please like, subscribe, all that good stuff, and have a good evening.